So Dr. Calum Miller currently works at the Oxford Centre of Christian Apologetics as a research fellow, speaking on difficult questions about Christianity. He has worked for 4 years as a medical doctor in the UK and is currently locuming in general surgery. Furthermore, he teaches philosophy and ethics at the University of Oxford. He is currently conducting research on abortion ethics and policy, but has published a wide variety of topics, and is writing a book on the historical reliability of the New Testament. He has spoken at over 20 academic conferences internationally, and has spoken on the topic of abortion on the BBC and at the White House. He has a master's in biblical studies and has taken part in excavations in Jerusalem. So, without further ado, Dr. Calum Miller.
Thank you so much, and thank you. I want to reiterate Mike's welcome to people, whether you agree with the CMF or the Pro-Life Society or the Christian Union. Whatever your views, you're very welcome here, and I hope that the main thing you take away from tonight, if anything, is just how welcome you are. I don't come here to berate anyone or to condemn anyone or to judge anyone. I really hope that you'll come away feeling at least welcomed, even if you disagree vehemently or otherwise. Now, I realise that this is an immensely difficult and sensitive topic, that should go without saying. And for some people it will nevertheless be a somewhat theoretical or abstract topic. It will be something that they haven't really thought through in a personal capacity. But for other people here, it will be a very real situation. Either someone you know will have had an abortion, someone very close to you, you may have had an abortion or considered an abortion, you may have been involved in an abortion otherwise. And probably that's the case for most people. It certainly is the case for most of us over in Great Britain. And so I want to recognise just how real and difficult this topic is. And so I want to come here primarily as a doctor, understanding that reality and having dealt with people who have been through immensely difficult experiences. And I wanted to share my experience as a doctor who has worked in a nation or an area where abortion has been legally accessible under a wide variety of conditions. And that will be the perspective I'm coming from. I realise with the title of this event it might seem in some sense, the slide's not clicking, we'll go with that. The title might have seemed somewhat provocative in the sense that often we feel that women are without a voice in this context. Now, you will have probably guessed from the title that the perspective we're coming from is the voicelessness of unborn children, but I also want to recognise the voicelessness of women in many societies, and including our own Western societies. And so I don't want to demean that, I don't want to undermine that, and I want to be very clear that I accept challenge or discussion or rebuke, or any challenging that you want to do, and I would love to have a discussion afterwards and respond to any of your questions. There's no question off limits. I want to engage with everything you have to say and listen to what you have to say. We did extend an invitation to the medical students for choice who, for reasons we won't go into, it's nothing sinister, respectfully declined, and there's no hard feelings about that. But I say that just to say that we are clear that we do want to engage in dialogue, and we are very much open to your questions. So please don't feel that we don't want to hear your voices. The only caveat left for me to say before I begin with the main material is really to apologise in advance, just in case I do show any lack of sensitivity during this lecture. I can assure you that it's not intended, that I am being as sincere as I possibly can. It's just an immensely difficult and emotive subject to speak about, and probably most of us would come into difficulty speaking on something like this, no matter what perspective we're coming from. For the most part, I won't be talking anything about religion. I'm going to be saying that actually, whether you're religious or not, you can have a pro-life view, and I'm going to be making the case for that and giving my experience primarily as a researcher in the ethics and policies surrounding abortion. But I do want to say something about Christianity just to give a context for how I'm approaching this. And what I'm wanting to say really here is that Christians have a duty to engage respectfully and to engage non-judgmentally and to engage sincerely with people. In the New Testament, St. Paul, who is one of the kind of leaders of the early church, he says it very clearly to Christians, and something that actually sounds unfamiliar to many non-Christians when they think about the church. He says, "Do nothing from conceit, but rather count others as better than yourselves." And so I really hope that you will feel that from me, that I don't count myself as better than anyone, probably worse than everyone here. And I really don't intend to be putting myself on a platform, even though it would help because I'm about 5 foot, and so I would immensely appreciate a platform. To move on to the material then, one of the first things I want to begin with is to look at the way that this debate is often framed, which is a kind of battle between women and the unborn child, as if it's a kind of conflict of rights. And actually we can see this on both sides. From the pro-choice side, we can see that they're kind of putting more of an emphasis on women, and for the pro-life side, they might be putting more of an emphasis on the unborn child. And it seems like inevitably it's just a clash and a conflict of rights or interests. But what I want to suggest today is that the pro-life view is that both lives matter, and that we should do our very best to support both lives and to love both lives. And so I want to begin by giving a few ways that I think abortion, whether kind of deliberately or not, has been used as a way of undermining women's rights, and has been used as a tool of oppression against women, and has been a way that really has undermined the feminist cause and the cause of women more generally. One of the most clear instances of this is if you look at abortion globally. So the United Nations Population Fund are officially neutral on the subject of abortion, but in reality they spend a lot of money through kind of mediating NGOs to lobby for abortion change in other parts of the world. And so the kind of emphasis and the kind of standpoint they're coming from is very much a pro-choice one for the most part. And you'll see this when we read their statement. But nevertheless, what they have said is that there are about 120 million women or girls missing in the world today. So there are about 120 million more men or more boys in the world today as a result primarily of sex-selective abortion, sometimes sex-selective infanticide, but usually sex-selective abortion. And what that means demographically and what it means culturally is that whether abortion has to be used this way or not, it is in fact something that has been used as one of the most powerful tools of oppression against women and against women's voices that the world has seen in modern times. And that's something that I think helps to put things into perspective for me. The second reason I think we have to approach this a little bit differently by finding a middle way that seeks to uphold the rights of both women and their children. And the reason why compassion I think is immensely important in this conversation is because actually, although we hear lots about choice in the debate, and often abortion is a choice, many times abortion isn't a choice, and coercion is much more readily kind of around, it's much more prevalent than we might have anticipated. And this can be from a number of standpoints. It can be from abortion providers or doctors, it can be from family members, it can be from abusive partners, it can be from friends or family. Coercion from all these people is extremely common. There was one study in the US that found up to 64% of women felt pressured to have an abortion, and up to 52% felt that they needed more time to make their decision. In another study done by the Guttmacher Institute, a pro-choice research institute in the US, even they found that 23% of women they interviewed said that one of their main reasons for having an abortion was that their partner did not want the pregnancy. Looking kind of more institutionally, we see that coercion, and whether it's hard pressure or soft pressure, the pressure actually is fairly often there in the institutions. A good example of this is a CQC report. So the CQC, for those who don't know, is essentially the main regulator of healthcare institutions in the UK. They're neutral. I have no idea what their stance is on abortion, probably neutral. At least officially it would be neutral. And I don't know what the makeup of the group is, but they're not a pro-life organisation. When they were inspecting, kind of from a safety perspective and a legal perspective, Marie Stopes kind of clinics, and Marie Stopes is one of the main abortion providers in the UK, they found that actually quite a widespread way Marie Stopes staff felt pressured to encourage their patients to have abortions, and that they actually felt that the number of abortions performed at the clinic was a performance indicator that they had to meet as targets. They also found that there was a company-wide policy across Marie Stopes of calling up women who had gone to the clinic and decided to continue their pregnancy. There was a company-wide policy of calling those women up and asking them if they wanted to reconsider and have an abortion after all. And finally, in certain kind of clinics within Great Britain, they found that it was fairly routine for children to have abortions without any kind of appropriate proper consent given, and that staff were not trained to properly take consent. And in fact, in some cases, they found that Marie Stopes were trying to force abortions on women without their consent, and this is all officially laid out in their report. The final reason why I think we shouldn't see this as a battle between women and unborn children, and yet another reason why I think compassion has to be at the heart of our discussion on this, whether we're pro-life or pro-choice or somewhere in the middle, is that abortion, when you look at the evidence and when you hear the stories, whether they're anecdotes or journal papers or reviews, abortion doesn't seem to be associated with mental health improvements, even though that's the justification for 98% of abortions in the UK. In fact, it seems that the most recent and the most kind of up-to-date evidence suggests that abortion is associated with worse mental health outcomes, which as a doctor is something that is profoundly important when I'm speaking to someone who is considering an abortion, and should be central to all of us who are in the healthcare profession when we're dealing with people who might want an abortion and think that it will improve their mental health. This is Annabelle Penhaligon. She was writing, I think, for the TAB. She was a student, I think, at the University of Birmingham, and very much from a pro-choice perspective, saying that she really resented the establishment of a pro-life society at her university. And she kind of gives testimony to the traumatic nature of abortion, which I don't think many people would deny. And she puts it this way, she says that abortions are never taken lightly. It takes weeks of tossing and turning, guilty feelings intermingled with self-hatred and doubt, and this doesn't go away after the abortion either. Now, if you contrast that with some of the scenes in the Irish Parliament that we saw during the legalisation process in the Republic of Ireland, we saw kind of leading politicians there saying that abortion regret was a makey-uppy thing, that it didn't exist, that no one ever regretted their abortion. And I think this is profoundly worrying if we're actually concerned about the safety of women and the psychological repercussions of pregnancy or of abortion on women. But this is a kind of opening example, I think, of someone who's quite candidly laying out the traumatic nature of abortion. And that's not to say pregnancy is not also traumatic, but it's just an introduction. As I said, in most countries, particularly developed countries, most abortions are carried out officially for mental health reasons. Certainly in the UK, where we don't officially, or in Great Britain I should say, where we don't officially have abortion for socio-economic reasons or on request. In Great Britain we have abortion for the most part for mental health reasons, is what's put down on the forms, and this is 98% of abortions in the UK. But in fact this isn't clinically tenable if we actually look at this from a medical perspective. As I said, the most recent up-to-date review, which has looked at a lot of the literature, and which was actually published by a pro-choice researcher in New Zealand, David Ferguson. He says he's politically pro-choice, he thinks abortion should be legal and widely available, and he's kind of essentially the top researcher. He passed away a couple of years ago, but he was until then the top researcher on the issue of abortion and mental health. And publishing in the Australia and New Zealand Journal for Psychiatry, what he said was this: at the present time, there is no credible scientific evidence demonstrating that abortion has mental health benefits, which is quite a staggering claim from someone who is himself pro-choice and who is one of the leading researchers on this issue, saying that actually the main justification for almost all abortions in the UK simply doesn't exist clinically. It's not a clinical indication for abortion. In fact, this view is fairly uncontroversial. So if you look at all of the reviews, there is not a single major review which says that there's good evidence that abortion is associated with improved mental health outcomes. So the Royal College of Obstetricians and Gynecologists, for example, which lobby fairly should be informed that the evidence suggests that they are no more or less likely to suffer adverse psychological sequelae, whether they have an abortion or continue with the pregnancy and have the baby. What's also uncontroversial is that abortion in some cases can cause mental health issues, and I don't know anyone working in psychiatry or obstetrics and gynecology who would deny that it can do in some cases, that it can cause mental health difficulties. The question is whether it causes more mental health difficulties or the same amount. So to look at that question very briefly, I just want to point to some of the main literature on this, knowing that this is primarily a medical crowd, and so I want to focus on this a bit more. There are 5 recent major reviews on this question of abortion and mental health. 3 of them conclude that there's no link between abortion and mental health, either way, that it doesn't help mental health, that it doesn't make mental health worse. There's no evidence either way. And 2 of them conclude that there's a negative link, that is, that abortion seems to be associated with poorer mental health than continuing an unwanted pregnancy. This has been a difficult area to study for a number of reasons, partly because of bias in the academy, partly because of censorship in the academy. One example of this is that David Ferguson, the pro-choice psychologist I mentioned earlier, he actually came out and said that he was pressured by the New Zealand government to not publish his results because they might be harmful politically. And this is a good example and a fairly paradigmatic example of some of the biases and the problems that come into this area when looking at this research. And of course, many researchers refuse to release their data for scrutiny by other groups. What's interesting, I think, about this data is that it doesn't just say that abortion doesn't seem to improve mental health. The data, if you look at the most recent and the best studies, actually seems to suggest that abortion is associated with poorer mental health. And so Ferguson's review in 2013 makes this point. He says, as a pro-choice psychologist, the evidence does seem to suggest that abortion is associated with worse mental health, and he gives some evidence that there is a causal relationship between them. And he gives a number of particular outcomes which are particularly associated with abortion, such as increased alcohol misuse, substance misuse, and suicidality and anxiety. And these were fairly concrete, robust associations. Even the American Psychiatric Association or the American Psychological Association, which ultimately in their report said that there was no link between abortion and mental health, or at least there wasn't good enough evidence yet, even they claim that among women with no previous psychiatric history, deliberate self-harm was significantly higher among women who had an abortion compared with those who delivered the baby. So I think actually there is good evidence, and like I said at the start, I'm more than happy to be challenged on that and to discuss the evidence in more detail. There's a lot out there and I don't have time to cover it all tonight. But I wanted to point at least to some of the mental health evidence, given that this is the primary medical justification for abortion. And it's one that is cited in the Supreme Court judgments, which are highly relevant to Northern Ireland. It's one that's cited in activist circles all the time. It's one that's cited by many professional bodies in many cases. So I think it is an important point to look at. The only other thing to say about this clause that allows abortion for mental health conditions or reasons in Great Britain is that as well as being 98% of these abortions, actually some of these abortions occur at very late stages in pregnancy. So these abortions for mental health reasons aren't just first trimester abortions, as 90% of abortions are, but actually a significant number of them occur very late into the pregnancy. So actually, we estimate that about 2,000 abortions after 20 weeks occur for mental health or socioeconomic reasons. And after 20 weeks, you're approaching the limit of viability. And I think most people would concede, and most of Europe certainly concedes, that they have a real hesitancy, at least, about abortion at that stage of pregnancy. This is just a quick graphic from a recent review by David Reardon, where he surveys the literature on abortion and mental health, and he goes through as many studies on the topic as he can find, essentially just to show that the large majority of studies, even though many of them are very poor quality, and he admits that, the large majority of studies do seem to show that there's a significant negative association between abortion and mental health. So looking at a particular instance of kind of mental health and looking at a particular clinical syndrome or a clinical condition or a symptom, one of the clearest kind of associations is the link between abortion and self-harm or suicide. This is significant because actually among women of childbearing age, suicide is one of the primary causes of mortality. So of women aged 15 to 24 in the US, aside from unintentional injury, it is the primary cause of mortality in that age group. Among the age group of 25 to 34, it's the third biggest cause of death. In 35 to 44-year-olds, it's the fourth biggest cause of death, and it obviously decreases as the populations get older. The reason this is significant is because actually the suicide rates differ enormously between women who have an abortion after an unwanted pregnancy and women who continue the pregnancy even when it's unwanted. You can get a fairly rough estimate of this just by looking at the kind of mortality data, which I don't think I have included it here. So if you look at the mortality rate for women of childbearing age, during pregnancy the mortality rate is substantial in the sense that sadly and tragically deaths during pregnancy do occur, and they occur at a rate in the UK of about 1 in 10,000 pregnancies. It's about 8 to 9 per 100,000 pregnancies. And that means that pregnancy, of course, can be life-threatening, and I would never want to deny that. And in those cases, it's extremely tragic, and the law in Northern Ireland, of course, allows for abortion where the woman's life is at risk at present. Contrast that, however, with the mortality rate for non-pregnant women of the same age. Actually, in non-pregnant women, whether they never got pregnant in the first place or whether they had an abortion, the mortality rate is significantly higher. So the mortality rate for an average woman of childbearing age is between 17.5 for the lowest age group and 144 for the highest age group. And so a rough measure, a rough comparison suggests actually that pregnancy, although it can be dangerous, is actually potentially much less dangerous than not being pregnant, whether through not getting pregnant or through having an abortion. Now that's a very rough measure, but it has been confirmed by more sophisticated studies. So this was a study from Finland, the one at the bottom, by Mika Gisla in 2004, published in the American Journal of Obstetrics and Gynecology. And what Gisla found was that the subgroup of women of childbearing age which had the lowest mortality rate was pregnant women, and it was about 26 in 100,000. These figures being from a couple of decades ago where the mortality rates were significantly higher. But the mortality rate for women who never got pregnant was much higher still. It was 57 in 100,000. And for women who had an abortion, it was even higher. It was 82 in 100,000. And suicide was one of the main kind of driving factors that caused this discrepancy. And so again, I think there's real reason to be concerned about the impact of abortion on women's mental health, particularly in the domain of suicide. And if you look at Ferguson's study, just going back to it here, Ferguson's study does look in much more detail at the confounding factors. He adjusts for all the confounding factors, looks at all the other possible reasons for this discrepancy, and concludes that even when you look at and take into account all those other factors, it still seems that suicide is linked with abortion, suggesting that there quite well might be a causal relationship between the two. So for all of those reasons, and I consider it's a quite long introduction, but for all of those reasons, this is a subject which requires the utmost compassion, which requires the utmost sensitivity, and which requires the utmost grace from a Christian perspective, and the utmost kindness. I think I've made a somewhat kind of beginning of a case, a rudimentary case, for the view that actually the rights of the women and the rights of unborn children don't have to be in conflict. That actually what's best for one is very usually the best for the other. And I think actually the medical evidence suggests this, and the medical evidence confirms this impression. But it does give us a reason to have the utmost compassion when entering these debates. The second kind of framework or lens for interpreting this debate or for having these discussions is one that's quite different but very much interrelated, and that's the framework of truth. Compassion is absolutely important, but I think most of us would concede that compassion without truth is empty, just as much as truth without compassion is empty. And so the second thing I want to look at is the reality of fetal development, the reality of abortion in Great Britain, and the reality of what I think has been a euphemization of fetal development and a euphemization of abortion in a jurisdiction where it has been legalized for 52 years now. To give you a kind of overview of these statistics, the statistics are surprising to some, not at all surprising to others, but I want to just give you kind of a sense of the reality of abortion in Great Britain. So in Great Britain there are over 200,000 abortions a year, which means that about 1 in 3 women in Great Britain will have an abortion in their lifetime. Worldwide the figure is obviously much higher, and it amounts to about 50 to 60 million abortions a year worldwide. In the UK, we have a somewhat strict legal framework for abortions. Now this has been manipulated and kind of reinterpreted many different times, but we do have kind of somewhat clear conditions for legal abortions in Great Britain. We don't have abortions simply on request at the moment. One of these conditions is the first one, which is that the pregnancy is below 24 weeks gestation and there is deemed to be by 2 doctors a risk to the mental health of the woman. And as I said, these count for 98% of abortions in the UK, even though, as I suggest, I don't think the evidence supports that practice at all. The number of abortions for physical health reasons under the same clause is about 300 a year in the UK, if I remember correctly. Secondly, there are clauses about life-saving abortions or abortions to prevent grave, serious, permanent injury to the life of the woman, which I'll come to in a moment. And then finally, there's a clause allowing for abortion up to birth and during birth, if the child is, in the archaic language of 1967, handicapped, today we would say disabled or differently abled, or is found to have a reasonable probability of having some genetic or other condition that is deemed to be worthy of terminating the pregnancy. So to go through those, as I say, 1 in 3 women will have an abortion in their lifetime. 98% of these are for mental health reasons. 1 to 2%, pretty much the remainder, which amounts to about 3,000 abortions a year, are for what the law calls serious handicap. About a quarter of those are for Down syndrome, about 800 a year. A number of those are for many other reasons, including cleft palate or because the baby is a triplet or a twin. 3,000 of these abortions are after 20 weeks, so of course that is a small minority of abortions in the UK, but nevertheless a substantial number of late-term abortions. And about 99 at most are to save the life of the woman, and as I suggested earlier, that's already legal under Northern Irish law. So to look in more detail at those life-saving abortions, for emergency life-saving abortions, there are about 1 a year. It's an absolutely kind of exceptional case that is extraordinarily rare. If you're including non-emergency cases, the number goes up quite substantially, but still to no more than 100 a year out of 200,000. And actually, some of these aren't very well documented. When I did a Freedom of Information request on these, we found that at least 30 of these, I think, were for mental health reasons as well, without any further specification of the mental health risk. And despite the evidence that I pointed to earlier. And so it's not clear exactly how many of those 100 or so are genuinely life-threatening. Of course, in many of these cases, the woman's life being at risk also means that the child's life is at risk. And primarily for that reason, most pro-lifers already agree that abortion should be permissible in those circumstances, because the choice is between losing 2 lives or losing 1 life. And so we generally think that it's better to save the 1 life, and as I say, Northern Ireland allows that at present. Coming on to abortions for serious handicap or disability, as I say, in Great Britain and under the proposed law in Northern Ireland, these would be legal up to and during birth. There are over 3,000 of these in the UK, in Great Britain, every year, and these are increasing actually quite rapidly thanks to new diagnostic techniques for diagnosing prenatal conditions. About 80 to 90% of children diagnosed with Down syndrome in the womb are aborted. In other countries it's much higher, so in Iceland it's 100%, and this amounts to about 800 a year in Great Britain. As I say, it's legal to abort up to term or during birth in the UK. We don't know whether abortion during birth happens in the UK. When we put in a Freedom of Information request about this, we were told that we don't know if it happens. There's no evidence that it does happen, but it's certainly not legally prohibited. And it did happen in the US quite frequently until it was banned about 15 years ago. So it might happen in the UK, and is certainly legal in the UK. The disability doesn't actually have to be proven, so that you don't need to show with certainty that the child has a disability. This was tragically exhibited a couple of months ago in the Republic of Ireland, where within months of legalisation of abortion, a couple had a termination for their child who they thought had been diagnosed with Edwards syndrome, a fairly serious but not certainly viable condition for some time, often much longer than expected. The couple had the termination thinking that this child had Edwards syndrome, and it turned out that actually the test was wrong and that the test was not kind of foolproof, and so they ended up, I think, suing the hospital or suing the laboratory for kind of allowing them to terminate their pregnancy when actually their child was completely healthy. One thing that often comes up in these situations is the question of the torment of the woman. And for those of you who have been up to speed with the legal developments in Northern Ireland, you may have read the Supreme Court judgment looking particularly at the case of abortion in the case of kind of life-limiting conditions found in the fetus. Now, one of the things the Supreme Court judgment in the initial case by the Northern Ireland Human Rights Commission, one of the things that the Supreme Court really deliberated on for a long time was the psychological trauma that delivering a child with a life-limiting condition would have on the woman. And certainly no one would deny, and I certainly would not want to deny, that this is an extraordinarily traumatic and difficult diagnosis to be receiving. But again, what I think has often been under-described and under-represented is the evidence looking at mental health of women in these dreadful circumstances. So actually, if you ask women who have been through this and who have kept their babies and continued their pregnancies, there was a study just last year from Duke University showing that, no, sorry, from another university, showing that almost 98% of women who had the baby and who continued the pregnancy in those tormenting circumstances articulated that they had no regret whatsoever. So almost every woman who went through with the pregnancy in those conditions had no regrets. By contrast, another study from Duke University 4 years ago now compared directly women who received these diagnoses who had terminations and women who received these diagnoses who continued the pregnancy. And what they found, these researchers, was that those who had terminations in those conditions, in those circumstances, the women who had abortions had much worse mental health outcomes in terms of their despair, in terms of their depression, and in terms of their avoidance, kind of post-traumatic stress type symptoms. And so again, I don't think this evidence is often relayed to the public. It's certainly not relayed to women who have received this hounding news in many circumstances. And yet it's crucially important evidence because it does suggest that even in those difficult circumstances, perhaps the best of a bad series of variety of options. And women who have done so have said that they don't regret it, and that actually those few hours in some cases that they've spent with their child have been some of the best few hours of their lives. As difficult as that is for us to imagine, having not been in that situation, it's something that these women, if we listen to their voices, articulate. Now, you might think that this is somewhat scaremongering and say this is the extreme end of the law. What I want to kind of suggest to you is that pretty much every clause within the Abortion Act in 1967 has been kind of reinterpreted in the most liberal and permissive way possible, and in ways that in some cases are quite shocking. So no one initially saw that this situation would occur in Great Britain. So John Finnis, an eminent legal scholar at the University of Oxford, warned that the law would allow for abortion for cleft palate in the UK. David Steele, who introduced the Abortion Act in '67, he said he deplores this statement and that it was a gross calumny on the medical profession, and he finds such ideas totally discreditable. Harriet Harman, a prominent Labour MP, said that John Finnis and John Keown, another eminent legal scholar at Cambridge, she said that they should be reported to the Bar Society or to the Law Society to have their licences as legal scholars revoked for saying these things. And yet, if you look at the Department of Health statistics, there are about 10 abortions for cleft palate in Great Britain a year. And of course, as I said, for other conditions like Down syndrome, the numbers are much higher. Coming very quickly to late-term abortions, as I said, this is a small minority of abortions, but an important number. There are about 3,000 in Great Britain after 20 weeks. And again, the idea that abortions would occur at this late stage was initially unthinkable. But the unthinkable became thinkable over a period of time as the law progressively was relaxed in its interpretation. So Brightman initially said, when the law came in, a doctor does not need an act of parliament to teach him that elementary duty. The duty, he means, not to abort a viable baby after the limit of viability. And yet in the UK we do have a substantial number of abortions, 1,000 or 2,000 after the limit of viability, despite the claims that this would never happen. So all that to say that what seems like a somewhat moderated law or a somewhat restricted or a compromised law has deep, deep potential to be misused, and over time gradually becomes more permissive. One of the other kind of myths about abortion that we often hear about is the idea that unborn babies might be better off if they have their lives ended because no one would be there to care for them. Or sometimes we hear the accusation against pro-lifers that they're not looking after unborn children or born children, and so they have no moral authority to be saying that abortion shouldn't be taking place. But actually, and so you hear the question, for example, who's going to look after all these children that will be born if we don't have abortion? Actually, the reality is quite different, that if you look at adoption agency statistics, if you look at children in care and you do some digging on this research, you find that there are virtually no newborn babies who are left unadopted. In fact, the opposite. There is a huge demand for newborn babies from parents who want to adopt them. This was from an independent, a pro-choice newspaper article a couple of years ago. They were talking about adoption in general. And they said that this adoption agency doesn't list its name in the yellow pages because demand for babies is so high. Their fear is being swamped with calls. We just can't handle it. There aren't any more babies available, says a spokeswoman. And so again, there are lots of kind of myths that we hear about abortion that looking at the empirical evidence helps to dismiss. Another example, which I won't go into in detail, is the idea that abortion laws don't work, that they don't lower the number of abortions. We have a number of studies that show this to be false, and there's a list of them on this website, Secular Pro-Life. They have 2 different pages just giving a huge list of study after study which shows that restrictive abortion laws really do save lives. They do encourage and often enable and empower women to continue pregnancies that they were ambivalent about having or that they wanted to keep but didn't feel able to keep. So coming on to the reality of abortion itself and the way we speak about abortion, I think this is absolutely crucial because as a medical professional I've seen it euphemized so much throughout my career. These kind of couple of stories from The Independent I think highlight this really well. So this might be familiar to many of you actually being in Northern Ireland. This was an Independent article a few years ago saying that a woman has just been sentenced for the crime of abortion in the UK, and this was in Northern Ireland. If I'm not mistaken, I think it was a suspended sentence, and that, as far as I know, there's no woman in jail at all in Northern Ireland or anywhere in Great Britain for the crime of abortion. But all that to say is that The Independent was presenting this as something that was absolutely awful, absolutely harrowing, and certainly most pro-lifers do not want to see women put in jail for having abortions, and I want to make that quite clear. But what is interesting here is not so much the case itself, but the double standard that we see when we look at other stories from the same newspaper. Because in this case, it was outraged that someone had gone to jail, or not gone to jail, but been sentenced for the crime of abortion. But just a few months earlier, they had said almost the same thing, but in a slightly different context, and thought that this was a good thing. So they said a man was charged with, not abortion, but child destruction over an attack on a pregnant woman in a London street. And in this case, The Independent, which is a pro-choice newspaper, which in the other case would never call a child an unborn child or an unborn baby. It would always euphemize it and talk about it as a pregnancy or a product of conception. In this case, it calls it child destruction, and it says that the 21-year-old victim of the attack, who was 32 weeks pregnant, lost her unborn child. And so often we hear of these kind of stories of products of conception or clump of cells or pregnancy or pregnancy tissue, and we think that that is the medical reality. But I think actually when we're not speaking about abortion, most people are willing to concede the reality that this is an unborn child that we're speaking about. Sometimes this slips out again from vehemently pro-choice advocates. 2 more examples. Hillary Clinton, who as a Democratic candidate in the US had to be completely pro-choice, said the unborn person doesn't have constitutional rights. Now, of course, all persons have constitutional rights. That's almost the definition of a person. But I don't think she intended to let slip that phraseology of an unborn person. Likewise, Planned Parenthood, the main abortion provider in the US, accidentally retweeted an article, I think from the New York Times, saying that after surgery in the womb, a baby kicks up hope. Now, of course, you would never hear them speaking about a baby in other contexts. Looking at the reality of fetal development, I'm not going to spend a long time on this, primarily because many of you are medics and will already know everything about this. But for those of you who aren't, I think often people are surprised by just how early we see substantive developments in embryology. So the heartbeat begins about 3 to 4 weeks after conception, and the brain has started to take shape a week later. And if you go through the NHS website, on the abortion section it will talk about pregnancy tissue or products of conception. But in the pregnancy section, it will talk all about what happens in the womb, and it gives a week-by-week stage account of what happens in the womb. And it will tell you when the baby, using that language, it says your baby now has fingernails, your baby now has taste buds, your baby is now able to swallow. And all of this is remarkably early, so that by the time you get past the first trimester, there's really not much else left to do other than just continue growing in size and further developing the structures which are already in place. By contrast, or in the same sort of way at least, the reality of abortion I think is very frequently euphemized, particularly by my own profession. and by the profession I assume of many people in the room today. I'm not going to go into detail on this again because many of you will already be familiar with it, but I just want to give an indication of how these debates can be euphemized, because I think language is crucially important when it comes to determining who is a human being. So if you look at the NHS website and you look at the description of a second trimester surgical abortion, a dilation and evacuation, it says this is used from around 15 weeks of pregnancy, and it involves inserting special instruments called forceps through the cervix and into the womb to remove the pregnancy. And it sounds very clean and very neat and fairly uncontroversial. If you read the kind of guidelines on how these are performed in various kind of fora, like the American College of Obstetricians and Gynecologists, it will give you a bit more detail when they're actually talking in a medical context. So it says usually disarticulation or dismemberment occurs as the physician delivers the fetal part grasped in the instrument and pulls it through the cervix. Likewise, a guide to second trimester abortion, looking at the surgical section by IPAS, another major global abortion provider, talks again about the reality of second trimester surgical abortion. It says occasionally during the evacuation, the calvarium, i.e. the skull, can become trapped. And it goes on a bit further. It is usually necessary to collapse the calvarium, collapse the skull with forceps to withdraw it easily through the cervix. At the end it says examine the fetal tissue to ensure that the evacuation is complete. Identify the fetal parts, especially thorax, spine, calvarium and placenta, and beyond 15 to 16 weeks also identify all 4 extremities. And if there's any doubt, use ultrasound to confirm that it's being completely evacuated. And after the procedure, it explicitly says cover the fetal tissue to keep it out of the woman's sight. There are about 9,000 of these procedures a year in Great Britain. Now, as I say again, this is the minority of abortions, and I don't want to pretend at all for a moment that this is the majority of abortions. And I would never want any pro-life kind of society or institution to suggest that most abortions take place this way. But 9,000 is still an extremely large number. And it's a number that really shocks people. And when I've spoken to people who are pro-choice, and I've told them that there are 9,000 of these procedures a year, they are absolutely stunned to find out that this is the reality of abortion in the UK. It's not the majority of abortions, but it's still 9,000 instances of this procedure, which most people in the public are entirely unaware of. To give you another kind of example of just how radical the position in Great Britain has become, this is actually just from a couple of months ago. We often hear the kind of claim that abortion is about choice, and that if you don't want an abortion, you don't have to have one. People will often say things like, no one's going to force you to have an abortion, you should just stay out of other people's lives and let them choose what they want for themselves. Well, actually, this isn't quite accurate, because in Great Britain we do have forced abortions. Often, they aren't common, again, they're not happening all the time, but they do happen and they're legally allowable. In this case, there was a woman with learning difficulties. Some of the media outlets were reporting that she had a mental age of about 6 to 9, other places were reporting about 12 to 13. There was a bit of discrepancy on the woman's mental age. The doctors essentially thought that she should have an abortion even though she wanted to keep the child. And they eventually took it to a court and asked the judge to decide what should be done. And the judge actually said that evidence indicated that the woman wanted to keep the baby, and yet the judge ruled that the abortion should still be carried out against this woman's wishes. And we heard kind of in the media reporting on this that to try and placate the woman who did not wish to undergo the procedure, doctors told her that she would be given a new doll to play with after undergoing the abortion in place of her child. And so again, this isn't to say that this is the mainstream experience of abortion in the UK or in Great Britain, but this is to say that actually when we allow for laws that are quite permissive, and when we allow kind of compromise laws, they're very frequently twisted, and they often give far more radical outcomes than we would have expected, and outcomes in this case which really are quite horrific, and which all people on all sides should be opposed to. There are a number of other instances of just how radical kind of law has been interpreted in the UK, or in Great Britain, I keep confusing them. And I'm just going to list them off just to save time, not to undermine the seriousness of them. But in the UK, in Great Britain, we've seen pre-signing of abortion forms where doctors and nurses have not done anything to check that the woman meets the legal requirements for abortions. We've seen the legality of sex-selective abortion, so when a doctor was caught agreeing to a sex-selective abortion, the Crown Prosecution Service dropped the case, saying that it wasn't in the public interest to prosecute. And actually a top legal scholar at Oxford who's pro-choice and a feminist has said that sex-selective abortion under our current law is legal. Partial birth abortion is legal in the UK, and we don't know if it happens, but it might do. We've seen live babies left to die after failed abortions and not given life kind of sustaining care. We've seen abortions for cleft palate or for twins or triplets, and these can be up to birth in Great Britain. We've seen aborted fetuses incinerated to heat hospitals. Most recently, we've seen BPAS, one of our main abortion providers in the UK, oppose a new law which was supposed to have coroner's inquiries into stillbirths in an effort to prevent stillbirths and to allow women who wanted to keep their pregnancies to have those stillbirths investigated if they wanted, so that these can be prevented in future and save lives for babies who were wanted by their parents. BPAS opposed that because they thought it might threaten abortion rights. Also in the UK, we've seen millions and millions of pounds spent on pressurising developing countries to introduce abortion laws against their wills and against the population's wishes. £600 million more was just announced a couple of weeks ago for this. We've seen doctors forced to refer onwards for abortions even when they don't see a clinical indication for it. We've seen professional bodies hijacked to lobby for abortion, often against the wills of their members, often ignoring the evidence and sometimes promoting these to school children. We've seen the head of BPAS, Anne Furedi, say, "I want to be very, very clear and blunt. There should be no legal upper limit for abortion." We've seen at Murray Stopes clinics that the CQC found that consent was routinely accepted from children without proper assessment of their ability to understand the risks. We've seen a litany of medical safety issues, which actually led to a suspension of abortion services at some Murray Stopes centres because it was so unsafe. And just this last week, we've seen an MP calling police against people who were protesting her entirely legally and entirely peacefully, simply because she didn't like their message. She called the police on them, threatening their freedom of expression. The proposed law in Northern Ireland is actually more extreme than that because it goes beyond the Abortion Act of 1967. So it has virtually no safeguards on the location of abortions, on parental consent, on the approval by two doctors, on the method of abortion, on conscientious objection, and it probably would allow abortion up to 28 weeks, which is even further than the UK at 24 weeks, Great Britain at 24 weeks. Abortion laws of this kind are not wanted by the people of Northern Ireland. Now, before you accuse me of telling you what you do or don't want, and I'm very aware of the risk of that, if you look at abortion opinion polling, it is the case that most people in Northern Ireland do seem to support abortion, the legality of abortion, for extreme circumstances like sexual assault and life-limiting conditions. That does seem to be fairly clear in the opinion polling. But in that same opinion polling, it also says that the people of Northern Ireland, by a significant majority, oppose introducing abortion for socioeconomic reasons, which is what this law would do. And so given that those abortions are the large majority of abortions, most people in Northern Ireland still do, according to opinion polls, reject this sort of law, and especially they reject it being imposed by Westminster. Stella Creasy, the Labour MP who's been pushing a lot of this, actually specifically sought assurances in the Houses of Parliament that Northern Ireland to insist and require that there was no public consultation with the people of Northern Ireland so that she could push it through for them. And just to give you a sense of how radical this would be, so most of the world kind of prohibits abortion in most circumstances from conception. The European average for an abortion limit is about 12 to 14 weeks, even very progressive kind of liberal countries in Scandinavia. 22 weeks is about the limit of viability. In Great Britain, we allow abortion for pretty much any reason up to 24 weeks, along with Holland and Singapore. And then up to birth, it's just a handful of countries like North Korea, China, Vietnam, Canada, and parts of the US. The new law that Westminster is trying to impose on Northern Ireland puts Northern Ireland between the UK or Great Britain and Netherlands and the rest of the countries on the right-hand side. So it really is a very extreme law. Finally, I want to just give you, in closing, a brief case for actually why people would be pro-life. And I realise many people would have come to this lecture expecting that that was what the entirety of this lecture would be about. There is much more that can be said on this, and I would be more than happy to speak at length on this question. But what I found speaking to people in the past is that even just explaining the reality of abortion laws, and the implications of abortion laws, is really something that most people find quite surprising and want to know about. And so that's why I've mostly focused on that. It's not because I don't think there's a good secular kind of reasoned case to make for being pro-life. But actually I think that case can be made fairly concisely and in a very simple way. And obviously I'm very happy for people to give me pushback on this, to challenge this, but here is a rough outline, I think, of how I came to my position at least. I wasn't pro-life until I went to medical school and read about this and researched it and was reasoned into this position through my studies in ethics. One of the things that I think is helpful to begin with thinking about this question is that almost everyone already agrees that some abortions shouldn't be permitted. If you ask people in Great Britain, pretty much everyone will say that they're pro-choice. I know only a handful of pro-life people in Great Britain. Almost everyone will say that they're pro-choice and that abortion should be allowed. But if you ask them, should abortion be allowed because of the sex of the baby, they almost always say no. If you ask them, should abortion be allowed up to birth, they almost always say no. And what that means is that most people have a view somewhere in the middle. And what's interesting about that is that it means that almost everyone, everywhere, with a few small exceptions, believes that there should be some restrictions on abortion. It's not because they want to limit women's choice, it's not because they're anti-women or because they want to control other people's bodies. It's because most people appreciate that at some point in pregnancy, the fetus or the kind of thing in the womb, whatever it is, becomes something that has its own rights and that has its own individual status. And most people agree with this, which is why most people support some limit on abortion. And it's nothing to do with restricting rights or restricting bodily autonomy. And so what that means is that actually most of us have some common ground. We think that if there is something in the womb which has equal rights, which is a new individual, which is not just part of the mother, that thing should be protected. It's not because we want to ban people from doing things or restrict people's access, it's because we want to protect individual human beings, and we just disagree about when human life begins. So here's an argument that I found very compelling that essentially converted me to my position in the first place. And it really began with a fairly uncontestable premise in the first place. It just says this: all human beings are equal in dignity and value with equal rights. And hardly anyone, it seems, would actually dispute that. Indeed, it's the foundation of much of our law and our international human rights law in particular. So the Universal Declaration of Human Rights says, recognition of the inherent dignity and of the equal and inalienable rights of all members of the human family is the foundation of freedom, justice, and peace in the world. Likewise, an actually legally binding convention signed by most countries in the world says very clearly the child, by reason of his physical and mental immaturity, needs special safeguards and care, including appropriate legal protection before as well as after birth. And actually most countries in the world have signed up to this just a couple of decades ago. Denial of this premise, of course, has been the reason for some of the biggest moral atrocities in the modern world. And affirmation of this premise has been central to our thinking about democracy and about human rights. And it makes sense because we know deep down, for whatever reason we kind of base this belief on, most of us believe that humans are equal, that bigger humans don't matter more, that more independent humans don't matter more, that more intelligent or more consciously able humans don't matter more. No matter how big you are, or how able you are, or how independent you are, or how economically stable you are, it doesn't affect your fundamental status as an equal human being. So that really just means that the question is not, what do we do about conflicting rights? What do we do about women? How should we restrict their rights? It's not about that. The question is really a basic one about who is a human being? Are fetuses human beings? Because if all human beings are equal, and if fetuses are human beings, then it follows that they are equal along with the rest of us. But what really convinced me about this is that I didn't need to appeal to the Bible to believe that fetuses were human beings. I didn't need to appeal to philosophical arguments. I didn't need to appeal to my own personal opinion or my gut instinct. Actually, I looked at what the scientific textbook said. Whether something is a human being is a scientific question about when life begins. And although often in the popular discourse we hear, no one really knows when life begins and things like that, Actually, if you look at the scientific books, they're actually very clear. There was a study just last year by Stephen Jacobs who polled over 5,000 biologists in the US, many of whom were pro-choice, many of whom were pro-life. It didn't really matter. 95% of them said that life begins at conception or an equivalent view. And so if we take a scientific approach to this, it seems clear that life begins at conception, and therefore that the unborn really are human beings. And these are just a couple of examples that you will be able to find in your Langmans. These are both directly from Langmans at different stages of development. This is a 20-week MRI of a fetus, which I think is from the US, I'm not sure. But you can see that this is much more than just a clump of cells or pregnancy tissue. This is a human being. So what that means is that we have a very simple argument for the pro-life view. All human beings have equal rights. Fetuses are human beings, so fetuses have equal rights. And those in the ethical literature who have rejected this argument tend to say that actually human beings aren't equal, that less developed or less able human beings have less rights. And so people like Michael Tooley or Jeff McMahon or Peter Singer have defended infanticide and in some cases the killing of disabled people on the grounds that these human beings are not equal because they don't reach the kind of intellectual capacities needed to be a person with rights. That was a very quick kind of thumbnail sketch, and I appreciate so much your patience in listening to me. I want to reiterate, like I did at the beginning, that I'm more than happy for you to ask questions. I ask that you do it civilly and respectfully. You'll notice that pretty much everything I've said tonight, with maybe one small exception at the start, has been based on just the data from government sources, from medical sources, from journals and so on, and that I haven't appealed to religion in any way. This is all something that I came to my own view on as a result of philosophical and ethical and data-based argument. And so I don't think that it has to be a religious question. It is, of course, fair to note that this is a CMF event, the Christian Medical Fellowship, and I do want to say something very briefly about that, just in case you associate my opinions with which you might disagree with the CMF. I don't want you to dislike the CMF just because you dislike me. So here's what all of what I've said this evening, here's what it doesn't mean. It doesn't mean that you have to be religious to be pro-life. In fact, the opposite is true. I wasn't pro-life because I was religious. I was religious for a long time before I was pro-life, and it was the arguments and the evidence that convinced me to be pro-life. Another thing that it doesn't mean is that Christians are better than anyone else. As I said at the start, the Bible is clear. Christians are told, do nothing from conceit, but count others as better than yourselves. In fact, it means the opposite. It means that Christians aren't better than anyone else. And the reason we're giving lectures like these isn't because we think we're better, it's not because we think we have a moral authority to speak from, it's because we have been convinced that we need to stand up for the vulnerable in our society, even when it's controversial or difficult or professionally risky to do so. We believe that human beings are equal, and as I've suggested tonight, you can have a number of reasons for thinking that. You can think that human beings are equal because it's your gut instinct, you can believe it because you've been taught it, you can believe it because your philosophy backs it, you can believe it because of the Bible. We all disagree on why human beings are equal, but most of us would agree that human beings are in fact equal. But what that means is that Christians don't love unborn children more than anyone else. They don't think that unborn child outweighs the rights of anyone else. They think that unborn children are equal. And that means something quite radical for our view on abortion. It means that we think that unborn children should have the same protection as anyone else in the world. But what it also means is that we think everyone is equal, whether they have the same view as us or not. It means that if someone supports abortion, has had an abortion, has paid for an abortion, is considering an abortion, supports abortion rights, those people are equal too, and just as much, just as worthy and just as deserving of our respect. We believe that God loves everyone the same, no matter what they've done or no matter what they will do. In fact, he loves them so much that he sent his son to die for them. A really quite radical view if you study the history of religions. He sent his son to die for me, he sent his son to die for you, he sent his son to die for the unborn child, no matter what you've done.